Hi, everybody. Good evening. I'm going live to talk about aesthetic regulation. And not just me, I'm going to talk about aesthetic regulation, put lots of questions to Dr. Tristan Mehta of the Harley Academy, who is very well up to speed on this because they've been hugely involved in all of the stuff that's going on. I'm just going to pin a comment in here and get that set. Hello everybody who's joining. Lovely to see you. Thank you for coming by. If you've got any comments and questions about aesthetic regulation, I'm going to ask Tristan as we go along. But when you have more, because we've had the consultation period after the initial launch. Hi, Tristan. Hi there. How are you doing?
Hey, hi Alice. I'm fine, thank you.
I
Got
gather
a little.
your voice is a bit on the croaky side.
Yeah, it might cut in. I've just somehow over the last few days, it's probably the first time in my life actually I've lost my voice. I don't know why. So if I cut in and out, it will be because I'm coughing.
Uh,
But if I talk like this in a nice slow even tone, we'll be absolutely fine.
okay, fine. No excitements. I mean, we've got a very calm subject, aesthetic
Very
licensing.
serious
Um,
subjects, yeah.
I,
Yeah.
I, I guess the first thing to ask would be, could you explain your involvement? You're in the Harley Academy, the involvement in the licensing, because I know you've had more of a role in this than most.
Yeah, sure, and I think it's been a topic that's been very close to me personally and in the business that we've built over the years. The origin of this idea of regulation goes back even beyond 10 years ago, when we had the original Sir Bruce Keogh report in 2012. I'm sure you know all of this.
Yeah.
It was around the time of the Health Education England process where I joined a committee, and I was part of a well, initially I just attended to learn what was going on, and and then I registered my interest because I wanted to understand where education is going in aesthetics. And so really it's been since 2015, I would say, where I've been part of the conversation, contributing, and obviously along the process, really interested in what the government's recommendations are for education. And of course, all the way to 2024 now, where it's actually really starting to happen. And so, yes, of course, I have my very clear agenda of wanting to build an education company around these standards. But the original intent was to try and help steer that and try and help understand that for the to drive up patient safety in the sector, and that's what we've been
Yeah,
working towards since the beginning.
sure. Well, it's a monster task, and as somebody who's just been reporting on it from the sidelines forever, it is a huge relief to see that something is happening and it is finally going to happen. But sort of where are we now with? I mean, is it impossible to say when we may be seeing this regulation coming into force?
Yeah, so I'm hesitant to say anything absolute because we know what it's been like, and we
Sure.
get excited at every few years. We get excited because we think regulations starting to happen. I think we can definitely say we're the most progressed we've ever been in the UK for regulating this
Yeah.
sector. I think that's really, really important. Um,
Okay. And there was the consultation period last year where normal people, as well as anybody in the industry, could give their views. And I think that, am I right in saying that had more responses to it
yeah, so there were
than,
thousands of responses,
yeah,
and this consultation process is part of the government's mandatory legal process before they create any form of
yeah,
legislation. So but these consultation is based around a set idea of or principles that have been developed over many years, and there are no surprises in this, right? So the
yeah,
idea that we have with the idea that we have some categories that are going to be under some form of almost surgical regulation like the CQC. We're going to have some interventions which rightfully are so high risk that they belong there. um, Brazilian butt lift, for example,
sure,
threads, things like that. Whereas we know also that things like injectables, which is a huge part of what we do, is going to live in the amber category. And the consultation process is really to establish. My cat's going to try. Oh, there we go.
Fantastic. Hey, kitty.
She likes to get involved. This consultation process is just reinforcing the kind of themes that we've been speaking about for a while. And the most exciting one is really about injectables and putting that in its right place to protect the public.
Yeah, and so who will need a license? I mean, it's going to be pretty well anybody who's approaching any level of aesthetics, whether it's the green procedures that anybody can do freely, the amber ones which need a bit more supervision, or the red ones which are restricted.
Yes.
Isn't it?
Yeah, and everyone will need a license,
Yeah.
Alice, and that's one of the key ideas here, is that there is no one who has an automatic level of understanding of this. Certain professional groups may not need to pass through the same hurdles, but they will still need to get for education because they are already deemed competent.
Sure.
For example, a consultant dermatologist.
Yeah.
But they will still need through their local authorities to get their license.
To get the license.
To practice,
okay. So at least for the consumer, it will become clear eventually that if somebody is doing anything to do with aesthetics, they need to have a license, and it will be very clear who has one and who doesn't.
Exactly. And so for the purpose of educating the public, I think our job gets a lot easier to signpost to the right people.
Yeah. So are there at the moment, the question is, are there any current regulations governing aesthetic procedures, and how do they ensure patient safety? I feel there are very few, but I think you will know better than I what there are already in place.
So there are some fundamental laws throughout the UK which have a very minor degree of protection. But ultimately, as you know as well as I do, the actual practice of this field is completely unregulated still. And so in a weird kind of backwards way, some of the most competent practitioners, which are the healthcare practitioners, are the ones who are most regulated right now.
Yeah.
And so have a more stringent set of requirements, which is great because it maintains the professional standards that we have as healthcare professionals. But of course, there is a lot of frustration in that, and I'm sure there is a spectrum of viewers on this evening who have a certain view. But no, I think the bar is very, very low, Alice. And so, being able to being able to point towards who is good and who isn't good is a valuable activity in the market.
Yeah. Are there any, because there are so few bars to this, what are the red flags that potential patients who might be watching this should be aware of when they're looking for a practitioner?
Okay, so the ones that spring to mind, price incentives. Okay, I think that it's very clear to you and me that the better practitioners are not really talking about those kinds of things. They're not interested in comparing themselves on price. So I think the closer that the practitioner looks like they're offering a purely beauty offering, the more likely they are going to be involved in non-medical practice, in an inability to actually manage their own complications, possibly acquiring their products from sources that aren't trustworthy. So I think pricing and how they are promoting themselves is a really obvious one, and I think that's a clear red flag to me.
Yeah, and I think it'd be worth making you sort of say this about, because people are always asking me, the complaining about the procedures I talk about being very expensive, and saying, could I get a bit more into the real world and talk about things that normal people could afford? And I find this very difficult because I find it's a bit like trying to talk about designer fashion also, and ways of doing it cheaply. You kind of really can't engage with aesthetics that are you might be lucky and get a kind of decent-ish result, but if you want a really good result, you're going to need to go to somebody who is highly trained, very experienced, has a lot of skill in there, a lot of practice in their background. Nobody gets worse with practice, funnily enough. You don't want somebody who's just started with it. And that is going to cost. And they're also going to be using products, decent products from very decent manufacturers, which are very well proven, which have often passed FDA regulations that they don't have to in this country. And those products aren't cheap either. So, because people are always looking for bargains.
Yes.
And apart from telling them to come to one of your training schools, where I know your trainees are very closely supervised, or to be a model for a good doctor, I can't really think of ways of doing it, because people will say, well, I know where the practitioner usually puts my toxin, so why shouldn't I go to this person down the road and say, this is the usual pattern they do? And you think, wow, good luck on having some inexperienced person guessing at the particular muscle patterns in your face. So that's a bit of a rant, but just saying,
No,
it's really hard to do cheaply. So I've missed a question there. What qualifications should I look for, says Sarah, from an injector to make sure they're safe? Well, there's pretty well none at the moment, are there?
so just to come back to your first point on
Okay, yeah.
I suppose on pricing, I do like that there is a certain arrogance in the sector, and a belief that, and I can totally understand that perspective from consumers or patients. You know, ultimately, these treatments are becoming more mainstream, and you know, rightly or wrongly, more and more patients are having treatments, and I do think the price point is going down generally. And just because you can now have botulinum toxin for, let's say it's £250, when previously, but by a medical professional, I should say, from a well-run clinic chain, you know, it would be wrong of me to say that some of these treatments are so specialist that only, you know, a doctor who's done 5 years of training post graduation and a qualification is the only person to do that. That would be wrong of me to say that, you know, because ultimately, technically, some of these treatments are relatively straightforward.
Yeah.
But I think the price point is sustained from the professional groups that should be practicing, and so it will never be £100, because you're taking up the time of a healthcare professional who has definitely done some training and ultimately post graduation. And so it will you know, we are still ultimately talking about luxury treatments. And so whilst I totally understand that there is this this frustration or this outcry at the price points, this is ultimately what we're paying for, is the medical skill and the knowledge of the individuals who should be practicing. And on the point around qualifications, so this is currently not a mandatory qualification. I think at the very baseline, we need to be looking for healthcare professionals. I would also recommend that that professional has the ability to prescribe. I think that is an important factor in who you're looking for. The reason there is because they can manage anything that they oversee. And so if there's a complication or if there's something to treat, they can prescribe. And then if you want a specific benchmark for actual quality of injecting and safety of injecting, then you can look for example, a level 7 diploma in injectables. And there are thousands of practitioners out there now who have been doing these higher education diplomas since about 2016. So there is a good body of professionals who have an even higher standard for their practice.
Yeah, thank you. I've gone back. There was one question saying, MD Hair One, that you're all for an upgrade in training standards. However, it's frustrating that the title of healthcare practitioner implies that the person is an expert in skin. I don't know what it implies. I mean, I think healthcare practitioners may claim to be experts in skin, but I think the point is that they are, that's the sort of basis before they start training in injections. That's what we're really talking about, not skin care. Let me scan on down here.
There are two fundamental ethical requirements from my perspective, which is that you have to be accountable to a professional regulator, which means that you sign up to a code of conduct. And secondly, you need to be able to manage any complications that you cause independently. So those are the two ethical principles, which then define, according to me and the people I work with, who should be practicing and who can get trained. That's quite straightforward.
Yeah. And the point about you were saying about that people need to be a prescriber, and for anybody who isn't a specialist in this area, I know we've got a lot of professionals watching. Um, the things, if somebody injects a filler and gets it into a blood vessel, where that filler can block the blood vessel, you then could get the tissue around that area dying if the vessel is blocked, or the worst case scenario, it's in the arterial lot that it can travel off up further up and the face and can cause further problems. But if somebody who is a prescriber has caused that blockage of vascular occlusion, is called, they will have to hand the injectable that can, in the enzyme that can be used to dissolve that blockage. So, but if they're not a prescriber, they won't, and they probably won't even know what they've done. If people do then complain, say they've got this swelling and it looks like a bruise, so it's usually very sore, they'll be told to go to A&E or something, and A&E doesn't know about aesthetic complications. Why should they? So that's a point about somebody being a prescriber, because then if something does go wrong, they will have access to hyaluronidase that can dissolve the enzymes for a start.
But you know what's interesting is so people, I think, over exaggerate that risk. I think that things like a straightforward vascular occlusion, you do have time, okay, even if it's not caught in the clinic. The bigger thing, and the thing we see in our training clinics, is that things like delayed inflammatory reactions, abscesses, nodules, those are troublesome. They require a range of different prescription drugs and specialist management. And this is much more common as well than a vascular event. And so if you ask our medical team, those are the main reasons to be a prescriber, is because you can have all kinds of things that can happen once we've injected a gel under the skin, and we have to be able to manage those. This is the fundamental reason why we are in a medical specialty. We're not doing things at skin level, and things can go wrong, and there's no way around that.
Yeah. Thank you. I see we got Dr. Land with us this evening. Always a pleasure, Stephen. You say you're working on it. I missed whatever it is you're working on. Do come back into to the conversation and tell us, because I feel there may have been a joke there. It may have been a serious point. You never know. Just, is there any advice you can give to patients considering aesthetic treatments to ensure they have a safe experience? What would be your sort of guiding principles for somebody who needs to go and find somebody decent to be treated by?
So I think the experience that you have with your clinician and in clinic should meet the standards that you expect. And like when you go in, and you have a proper consultation, someone's talking you through what your main concerns are. If someone is then assessing you and applying their knowledge and working with you on a treatment plan, if there's a thorough consent process, and you've done all the right checks in terms of the professional background, the qualifications, and most importantly, you're trusting your gut instinct on these things, then I think you're in the right place. If you get a strange feeling, you feel like you're being rushed, you feel like you're being pressured, if it's someone who you can't really find much about online, I do think there are some good references for who you can find. I think your guide, for example, there are definitely ways. There are definitely ways to minimize a bad decision, and one of them, unfortunately, is definitely not cutting costs. I think that is often probably the thing that leads to dangerous outcomes.
And not cutting costs and giving people time to consider as well. I get a lot of people asking me sort of, well, there's two different points. There's one, they feel they need to have the treatment right then and there, which they shouldn't be pushed to have. But they also often say to me that they feel they're being upsold.
Yeah.
But it's a difficult balance there, I can see, for the practitioner, because if you've got somebody who's 55 and has a lot of loss of volume in their face coming in, just wanting their lips done, there may, or one set of lines treated, there may be benefits to giving them a more overall treatment. But I feel if that is explained properly to them, then they won't feel they're being upsold, because they will understand why the practitioner might want to do a bit more in order to give them the results
Yes.
that they're after. You know, you've always got people who come in wanting a tiny 0.5 ml of something to make a, you know, basically give the results of a facelift, and that has to be explained
Mm.
very thoughtfully.
I,
Yeah.
it's often,
Uh,
you know, if something sounds too good to be true, it often is. If you go to
yes.
clinics, you should
Yes.
probably have a few painful truths that you listen to, and that means that your clinician's being pretty straight and honest with you. Um, and like with everything, it will take time to get to an outcome.
Yeah.
You know, time. If you want to skimp on time or money, that's when things go wrong, I
Oh,
think.
thank you. What Stephen was talking about was when I said A&E doesn't know about aesthetic complications, and he says he's working on it. That is fantastic to hear. Yeah, even if so I presume everybody in your area, Dr. Land, will be then directed from A&E straight back to your clinic, and you'll have to sort a lot of them out. Tristan, are there any other points you want to make before your voice gives out? I know we're going to have to end this in a minute so that you
You know,
can actually speak.
I've got a few more sentences.
Go on.
No, really, I think this is something that's very close to us, myself and my team and the company. We've got a lot we're working on in terms of adhering and driving these new standards. I still maintain that a minimum education requirement is essential. That's the way things are going. It's looking
Sure.
like it's going to be the level 7, and that's something that I've been passionate about from the very beginning. So I think we should feel very optimistic about the way things are going, to be honest, Alice. And I think we look back in this in 2 years' time, let's say 2 years' time, we could be in a completely different place. And
Good.
so I think a lot of the stressful questions that you get around what's right and what's wrong will be answered from high above, and that will make life a lot easier.
Okay, because what's the next thing that has to happen? Is it just the due processes of law grinding through their labyrinthine mechanisms?
There will be, so there's the response to the consultation. That will be the end of summer. And then from that response, the DHSC will then work in consultation with some of the associations that have been guiding them, for example, the JCCP, on what these education standards are going to be, the CPSA on what these clinical standards are going to be. And so from
Yeah.
that process, there will then be more formal processes put in place.
Oh, it is so slow from a consumer point of view. I mean, I say this as somebody who has an article in a cuttings book somewhere from 2001 saying goodbye to the cosmetic cowboys, which was when British Association of Cosmetic Doctors, now BCAM, was formed with a specific aim of bringing about regulation. And you know, so I've kind of given up on the fact that there would ever be regulation coming through. So it is fab. And also I speak as somebody who I wrote a big article about all of this last year about this time last year for a newspaper, which every 3 or 4 months they get very excited, they drag it up, they re-edit it, they get it ready for publication, and then at the last minute
Yeah.
that it doesn't make. So
Your
yeah,
big
from a
moment.
self-interested,
Your big
well,
moment is coming very soon, Alice.
I, I think, well, I would have thought the piece was dead by now, but it has been through 4 iterations. But the substance of it hasn't really changed, which is this regulation needs to happen. It is happening. It is going to happen in the end, but it's not here yet. So we'll all have to just wait for it all to happen. But look, thank you so much, Tristan, for taking the time, particularly when you're not feeling so great. And yeah, we'll do this again in due course when there is more to update people on.
That's perfect. Thank you for having me,
Okay,
Alice.
thank you. Bye now.
Bye.